All right, get ready to dive deep with us today because we're going to be tackling musculoskeletal coding.
Yeah.
We're using the AMCI guidelines you sent us, and it looks like some pretty tough cases you're working on.
Yeah.
But don't worry, we got you.
Yeah, we're going to break it down.
We're going to break it down together. And by the way,
Absolutely.
we have the Absolute Medical Coding Institute's Medical Coding Guidelines, MCG manual, linked in the description, so you can reference that while we go through this whole thing. But yeah, let's just decode this and make sure that you're coding these conditions accurately.
You know what I think is so interesting about these guidelines is just how specific they are.
Right.
It's not enough to just say, oh, this is the condition. You have to get into the location, the type of problem it is, what stage it's at.
Yeah.
I mean, it's like, where's Waldo?
Oh, I like that.
But instead of finding Waldo, you're finding the right code.
Finding the right code. Okay, so let's start with the big picture. Chapter 13 of these AMCI guidelines.
Mm-hmm.
What are some of the key things coders need to know when they're navigating this chapter?
So Chapter 13 is kind of our musculoskeletal headquarters.
Okay.
It covers everything from bones to joints, muscles, connective tissues, you name it. But one thing that a lot of coders trip up on is knowing the difference between a condition that affects the bone itself versus the joint.
Right.
So, someone might have hip pain,
Right.
but is it osteoarthritis, which is the joint? Or is it like a vascular necrosis of the femoral head, which is the bone?
Right. So you're not just coding the symptom of hip pain. You're really trying to get down to the root of what is causing this hip pain.
Exactly. What's the pathology behind it? And that's where your knowledge of anatomy and medical terminology really comes in handy.
You got to be a detective.
You got to be a medical detective for sure.
All right. So we've got our location. But what about the timing? How do we know if we're coding for a brand new injury versus a chronic or recurring problem?
That's another really key distinction. Chapter 13 is really focused on things that are chronic or ongoing.
Right.
So, let's say our patient comes in with knee pain. Did they just twist it playing basketball yesterday?
Right.
Or is this something that's been going on for years because they tore their ACL back in high school?
Interesting.
So if it's a new injury, you're probably looking at Chapter 19, which is all about injuries and trauma.
Okay.
But if it's something that's ongoing or recurring, then Chapter 13 is where you want to be.
So we're really paying attention to location and the timeline of this condition.
Absolutely.
Now let's talk fractures.
Okay.
Because I hear there's a whole secret language when it comes to coding those.
There is. The 7th character in the fracture codes gives you a whole other level of detail about that fracture.
Okay.
So, for example, A is going to mean active treatment.
Okay.
D is post-active treatment care.
Got it.
And there's all sorts of other characters for things like complications, like a delayed healing or non-union.
Oh, so it's really like you're coding the whole journey of this fracture.
Exactly.
From beginning to end.
The whole episode of care.
Yeah, and I imagine that's where documentation is super important.
Oh, it's critical.
Yeah.
You have to make sure the provider is clearly documenting the type of fracture, the treatment, and any complications.
And if it's not clear?
Query.
Absolutely. Because if we don't have the full picture, our code's not going to be accurate.
Exactly.
And speaking of conditions that need careful attention, let's talk osteoporosis.
Okay.
I hear this has its own set of rules.
It kind of does. Osteoporosis is interesting because it's a systemic condition.
Okay.
So it affects all the bones in the body.
Right.
That means that a fracture in a patient with osteoporosis is going to be coded differently than a fracture in someone who doesn't have osteoporosis.
So even if someone with osteoporosis, trips and falls and it seems like a minor fracture, we wouldn't just code it as a traumatic fracture.
Right. You want to capture the fact that osteoporosis played a role.
Interesting.
So it's more of a pathological fracture.
Right.
The bone was already fragile, and that's why it broke.
It's fascinating how much depth there is to these codes that seem so simple on the surface.
Oh, absolutely.
Like musculoskeletal conditions.
It's like peeling back the layers of an onion. There's always something more.
There's always more to discover. Well, we've covered a lot of ground already, but I feel like there's still so much more to learn. So what do you say we take a quick pause, and then we come back and dive into some more of these details?
Sounds great.
All right, we'll be right back.
We'll be right back. And something I find really helpful with Chapter 13 is what the MCG manual calls the flip and tap method.
Flip and tap. Okay, I like this. Tell me more.
It's basically a way to make sure you're applying the guidelines correctly.
All right.
So you're connecting those ICD-10-CM guidelines with the actual codes in the tabular list.
Okay.
And it's really simple. It's just 2 steps. First, you flip to the right section in the MCG manual,
Right.
which gives you like a nice, concise version of those ICD-10-CM guidelines.
Right.
And then you TAP, which stands for Tab, Annotate, and Place.
Wow.
So you turn to the correct tab in your ICD-10-CM manual, annotate the guideline next to the code, and then just put the word TAP there. So, you did it.
Oh, I like that. It's like leaving yourself a little trail of breadcrumbs.
Exactly.
So you don't miss anything.
You got it.
Okay. Well, let's go back to those 7th character fracture codes.
All right.
Because I think they deserve a little more attention.
Yeah, they're really important.
They're kind of like a secret decoder ring.
They are.
Can we break down some examples?
Sure.
I think our listeners would really appreciate that.
Absolutely. So let's say we have a comminuted fracture of the femur.
Okay.
If they're treating it with a cast, we're going to use the 7th character A,
Okay.
which means initial encounter for closed fracture.
Okay.
But if they've done that initial treatment and now they're in physical therapy,
Right.
then we would use D,
Okay.
which is subsequent encounter for fracture with routine healing.
So it's the same fracture, but the 7th character changes depending on where they are in that healing process.
Yeah, exactly.
What if there's a complication, though? Like the fracture doesn't heal properly?
Then we would use one of those other 7th character codes.
Okay.
So let's say it develops a non-union,
Okay.
meaning the bones just didn't join back together like they should.
Right.
We would use the character K
Okay.
for subsequent encounter for fracture with non-union.
So those 7th characters are really important for painting the full picture.
Yeah, the whole
Of the fracture.
Exactly.
High resolution instead of blurry.
I like that.
Okay, so those 7th characters apply to other conditions too, right?
Yeah, fractures, dislocations, joint replacements,
Really?
all sorts of things.
Interesting.
Okay.
Okay, so we're paying attention to location timing and the 7th characters.
Uh-huh.
Is there anything else we should be looking for when we're reviewing documentation for these cases?
Definitely.
Yeah.
You always want to pay attention to laterality.
Laterality.
Left or right.
Oh, right.
You got to specify which side.
That makes sense.
It seems simple, but it
Yeah.
can really make a difference in your coding accuracy.
I can see that.
Yeah.
Especially if
Yeah.
you know you have a patient with bilateral knee osteoarthritis.
Exactly.
You don't want to code for just one knee.
Nope. Got to code for both.
All right, laterality. What else?
Let's see. If they have a history of a previous injury,
Okay.
make sure the provider is documenting whether this current problem is related to that old injury or
Well-
if it's something totally new.
And if it's not clear,
Query.
query.
Always query.
Okay, we've been focusing a lot on fractures and bone-related conditions.
Right.
But Chapter 13 covers so much more than that.
Oh, yeah.
What about things like tendinitis and bursitis?
It's all in there. Tendinitis, bursitis, rheumatoid arthritis, lupus,
Wow.
the whole spectrum.
So it's really important to understand all the different conditions
Yeah,
and how they're coded.
definitely.
All right, what about those cases where you have multiple things going on?
Oh, yeah, the multiple sites problem.
Yes.
So in those cases, you want to look for those specific multiple sites codes.
Okay,
If there's a code for that combination, then you use it.
got it.
But if there's not, then you just code each condition separately.
It's like having a toolbox
It is.
full of code.
And you got to pick the right tool for the job.
That's a great way to put it.
Well, this has been so helpful.
Yeah, I'm glad
We've covered so much.
we have.
But I still feel like there's more to learn.
There's always more to learn.
So what do you say? We take another quick pause?
Okay,
And then we come back and wrap this whole thing up.
sounds good.
All right, we're back. And, ready to kind of put a bow on this whole musculoskeletal coding thing.
Yeah,
I've learned so much.
it's a lot to take in.
It is. But it's fascinating.
It is, and it really highlights how important it is to keep learning.
Right.
This field is always changing.
Yeah, new codes, new guidelines.
New technologies.
Yeah.
So you always got to be on top of it.
It's a never-ending quest for knowledge.
It is, but that's what keeps it interesting.
It does keep it interesting. So how do you stay on top of everything?
Well, I mean, conferences,
Right.
publications,
Professional development.
network with other coders.
Yes, absolutely.
Get those tips and tricks.
And, commiserate when you come across those really tough cases.
Absolutely.
Mm-hmm.
And, of course, the MCG manual,
Oh, yeah, your best friend.
our best friend. It's our guidebook.
It is. Don't be afraid to use it. Highlight it. Dog-ear the pages.
You know what else has been really helpful for me?
Yeah.
Is remembering to query the provider.
Oh, yeah.
If something's not clear,
Always query.
It's better to ask than to guess.
Absolutely.
And it really shows that you're going the extra mile to make sure it's accurate.
You're dedicated to accuracy.
Yeah, and that you're really advocating for the patient.
Exactly, because at the end of the day,
Right.
it's all about the patient.
It is, making sure that we're telling their story accurately.
Yeah.
And giving their healthcare providers the information they need.
The full picture.
Yeah. And, this whole conversation has really shown me that musculoskeletal coding, it's not just about numbers. It's about taking this really complex medical information and making it understandable.
Yeah, it's about communication.
Exactly.
And using that communication to improve patient care.
So to all of our listeners out there, as you continue on your coding journey, just remember, you're not alone.
That's right.
There's this whole community of coders who are there to support you.
Absolutely.
Share their knowledge. Celebrate your successes. So embrace those challenges. Stay curious. Keep learning. And don't forget to check out the Absolute Medical Coding Institute's Medical Coding Guidelines MCG Manual, link in the show notes.
It's a great resource.
It is. And that's all for today. We'll see you next time.